All right. Hi, Dr. Patel. Thank you so much for talking to us today. We're going to just dive right in. A lot of patients have questions about what they should be asking their fertility doctor. And so we have several that we want to talk to you about. So one question that, everyone should probably ask their fertility specialist is, when you hear trying to conceive, what does that really mean?
So typically, when we say trying to conceive, we mean the duration of unprotected intercourse. So typically, when we describe infertility, it's defined as an inability to conceive with unprotected intercourse over 1 year if one is under 35, or up to 6 months if one is over 35 years of age.
And question number 2 we should ask our fertility specialist is, I've been on birth control for forever, obviously trying to prevent pregnancy, but here I am and I'm seeing a specialist. So how long will it take my cycle to regulate?
So this is often a big misconception that I come across sometimes even daily. Patients tend to think that birth control pills may hamper their ability to conceive in the future, and that's the furthest from the truth. So being on a birth control pill is not detrimental to one's fertility. In the vast majority of patients, simply stopping the birth control pill allows a woman to become fertile, to regain fertility, essentially instantly.
How long for you to kind of go back to your regular cycle after coming off of it?
Most women will regain cyclicity in the next cycle after stopping.
Okay.
In rare instances, it can take women 3 to 6 months to regain cyclicity, but that's a very rare scenario. So most women, we stop the pill and they regain their cyclicity right away. And in fact, in a lot of fertility treatments that we do on patients, we have them on a birth control pill before starting their cycle. So we wouldn't do that if we thought it would impair a woman's chance of conceiving.
True. Question number 3. Is there anything that I can do on my own to improve my chance of success?
Yes, I think there's, especially during times like this when we're not able to treat patients due to the coronavirus at this point, I encourage patients to be proactive in terms of his or her fertility. And some of the things that I'd like to emphasize is leading a healthier lifestyle, observing optimal nutrition by avoiding processed foods and a lot of simple sugars and carbohydrates, engaging in routine exercise in a safe fashion, in efforts to also maintain a healthy body weight. This can have a tremendous impact on a woman being able to ovulate, as well as the health of the potential pregnancy and the baby as well. I think stress is a really big factor as well. It's one of our worst enemies, both on the female and the male side. And this is a stressful time for all of us. There's no getting around that. But trying to take proactive measures to protect your mental health, to have a healthy stress outlet. Some patients benefit from yoga, meditation, exercise to find your individual outlet that can relieve stress, can also augment fertility as well. I would really encourage addressing these points during these stressful times.
So kind of on the flip side of that, is there anything that we as women or our partners may be doing just in our day-to-day life that could actually hurt our chances of success that maybe we're not aware of, certain medications or supplements or anything like that we may be doing that we think are harmless, but really they're hurting us?
Absolutely. Yeah, one of the biggest things that we encounter nowadays is exogenous testosterone use. So we're seeing more and more men notice that as you get older, you tend to gain weight, tend to be sluggish, have reduced energy, whatnot, and you're tempted to check your testosterone levels, which invariably decline with age, and basically are tempted to replace that testosterone by taking exogenous testosterone. And it makes you feel like you're younger again, and increases vitality and sex drive and energy and whatnot. But in the vast majority of patients, it will take the sperm counts down to zero. And that can
Wow.
obviously, in that case, really hurt your chances of conception. So that's one thing that we see a lot, where people are surprised that they were trying to do something to restore health, but can result in infertility.
And then the last question, which is probably the most important kind of when you're going through the evaluation phase of finding a clinic to connect with, is what makes FST's approach to treatment different than others?
So we at FST, we really pride ourselves on individualized care. We feel that fertility is not just anything but bread and butter, and we don't use a cookie cutter approach. We really take our time to understand each and every patient's individual scenario, to really understand what he or she has gone through in the past, and try to customize a treatment that give them the highest chance of success. And another thing we really place a big emphasis on is the emotional health of a patient. We understand this can be incredibly taxing, incredibly stressful, and the scenario we're in right now with coronavirus times just exponentially increases that mental stress and exhaustion. So we really uh, we really try to take care of the patient as a whole, in efforts to try to help you through this and reach success.
Awesome. Well, thank you for talking with us today. And guys, if you're watching this and you have any questions specifically for Dr. Patel, and you want to know other questions that you should ask, or just any general questions at all, please post in the comments below, or you can email us at info@fertilitytexas.com, and also PM us through Instagram and Facebook. Thanks so much.